Imagine a world where the very medicines designed to save lives could be the silent killers lurking in your medicine cabinet. What if I told you that some of the most commonly prescribed medications are also among the deadliest substances known to mankind? In this eye-opening video, we're about to pull back the curtain on the pharmaceutical industry's darkest secrets. From blood thinners that can turn a simple cut into a life-threatening emergency, to painkillers so potent they've sparked a global epidemic, we'll count down the top 10 most dangerous medications in the world. But here's the twist. You might be shocked to discover that some of these drugs are probably sitting in your home right now. As we delve into this pharmaceutical hall of infamy, we'll reveal the shocking side effects, lethal interactions, and narrow margins of error that make these drugs so perilous. But don't touch that medicine cabinet just yet, because the most dangerous drug of all might not be what you expect. Stay tuned to find out which medication claims the #1 spot, and why it's still being prescribed despite its deadly reputation. Hey there, health enthusiasts and curious minds. Ever wondered what's lurking in your medicine cabinet? Today, we're diving into a topic that might make you think twice before popping that pill. We're exploring the world's most dangerous medications. These aren't your everyday aspirin or cough syrup. We're talking about drugs that can have serious, sometimes life-altering effects. So, buckle up and get ready for a wild ride through the pharmaceutical world's dark side. Let's start with a drug that's been making headlines: fentanyl. This synthetic opioid is 50 to 100 times more potent than morphine. It's used to treat severe pain, especially in cancer patients. But here's the kicker: even a tiny amount can be lethal. Fentanyl has been responsible for countless overdoses and deaths. It's so dangerous that first responders need special protective gear when handling it. Next up is Warfarin, also known as Coumadin. This blood thinner saves lives by preventing clots. But it's a double-edged sword. Too much can cause uncontrolled bleeding. Even a minor cut or bruise can become life-threatening. Patients on Warfarin need constant monitoring and careful diet management. Let's talk about thalidomide, a name that still sends shivers down spines. In the 1950s and 60s, it was prescribed to pregnant women for morning sickness. The result? Thousands of babies born with severe birth defects. It's a stark reminder of how medications can have unforeseen consequences. Now, onto a class of drugs that millions use daily: benzodiazepines. These include Xanax, Valium, and Ativan. They're prescribed for anxiety and insomnia. But they're highly addictive and can cause severe withdrawal symptoms. Long-term use can lead to cognitive decline and increased risk of dementia. Let's shift gears to chemotherapy drugs. These are literal lifesavers for cancer patients. But they're also some of the most toxic substances we willingly put in our bodies. They don't just kill cancer cells, they damage healthy ones too. Side effects can be brutal: hair loss, nausea, organ damage, and more. Have you heard of Isotretinoin, better known as Accutane? It's a powerful acne medication that can work wonders for severe cases. But it comes with a long list of potential side effects. These include birth defects, depression, and even suicidal thoughts. Patients need to be closely monitored and females must use strict birth control. Now, let's talk about a surprising entry: acetaminophen, or Tylenol. It's in almost every home, but it's not as harmless as you might think. Overdosing on acetaminophen is the leading cause of acute liver failure in the US. The line between a therapeutic dose and a toxic one is surprisingly thin. Moving on to metformin, a common diabetes medication. It's generally safe, but in rare cases, it can cause lactic acidosis. This is a potentially fatal condition where lactic acid builds up in the body. Patients with kidney problems are at higher risk. Let's not forget about Digoxin, a heart medication derived from the foxglove plant. It's been used for centuries to treat heart conditions. But the therapeutic dose is dangerously close to the toxic dose. Too much can cause nausea, vomiting, and even fatal heart rhythms. Lastly, we have Clozapine, an antipsychotic medication. It's a last resort treatment for schizophrenia. But it can cause a potentially fatal decrease in white blood cells. Patients need weekly blood tests for the first 6 months of treatment. Now, you might be wondering, why are these drugs still in use? The answer lies in the balance of risks and benefits. For many patients, these medications are life-saving or life-changing. The key is proper use, careful monitoring, and informed decision-making. It's crucial to remember that all medications carry risks. Even over-the-counter drugs can be dangerous if misused. Always follow your doctor's instructions and ask questions if you're unsure. Never share prescriptions or take medication not prescribed to you. So there you have it, folks. A journey through some of the world's most dangerous medications. It's a reminder of the power and complexity of modern medicine. Remember, knowledge is power when it comes to your health. Always be informed about what you're putting into your body. If you found this video helpful, give it a thumbs up and share it with others. Don't forget to subscribe for more health and medical content. Stay safe and stay healthy.